With the University of Rochester being the biggest employer in town and providing so much of this region's health care, what would happen if it lost its tax-exempt status? Well, now that President Trump is threatening to remove that status from Harvard, we posed that question to a local tax expert. President Trump this morning on social media said he was going to take away Harvard's tax-exempt status, saying they don't deserve it. This after he tried to exert more control over the school, claiming they did not do enough to protect Jewish students during pro-Palestinian protests. Local tax expert and longtime Trump critic David K. Johnston says no president can do what Trump is saying he'll do.
The President of the United States does not have the authority to revoke anyone's tax-exempt status, and indeed there's a federal law that specifically prohibits the President, the Vice President, or anyone on their behalf from interfering in the operations of the Internal Revenue Service.
But if Congress changes the law and Trump forbids universities, or many of them, from being a nonprofit, Johnston says it would mean goodbye to scholarships that now allow many students from low-income families to attend.
So if you want to limit who will be successful in the future to those who already are wealthy, that's a good policy. Take away the tax-exempt status of universities and treat them differently than you do today, and reduce the money that they get for research, which trains the scientists, the attorneys, the physicians, the biotechnologists of the future.
Also, he says, expect far fewer donations, as donors would likely no longer be able to write off their contributions. Then, for schools like the University of Rochester that also provide health care for an entire region, Johnston says this.
If you diminish the medical school and the dental school at the University of Rochester, you are choosing to live in a community that will not have the same quality and access to health care that we have today. There's lots wrong with our health care system. No question about that. But relative to the rest of the country, we're much better off.
Of note, should a university lose its tax exemption, as one might imagine, they'd have to pay more in taxes, which supporters of this move say could mean or would mean more revenue and possibly lower taxes for others. One other possible impact here: nurses and other staff of U of R who are currently enrolled in what's called the Public Service Loan Forgiveness Program, they would find themselves ineligible because they'd no longer be working for a nonprofit. In that program, if you make 10 years worth of payments, after you're done with that, whatever's left, that's forgiven. So you may have a situation here where a nurse decided to stay at the U of R. Because of that program, they made 9 years of payments, but then they can't receive what was promised.